Hi, I'm Dr. Chris Kammer. I'm a dentist based in Middleton, Wisconsin, and today I want to talk to you about cold sores, or fever blisters as they're also known. Did you know that they're a huge problem for about 60 million Americans? And cold sores are no fun. They hurt, they sting, and they itch and burn and tingle. They're ugly and embarrassing, and they can last up to 2 weeks. And they're contagious. You can give them by kissing or sharing eating utensils or off a razor or a towel or a toothbrush. So what actually are cold sores? Well, cold sores are small blisters that form on the lips and around the mouth and sometimes even at the base of the nose. They're clear and filled with fluid. Cold sores are also known as fever blisters or HSV-1 or herpes simplex, which is not the same as genital herpes, so make sure you know the difference there. Cold sores are caused by the herpes simplex virus, which lives inside your nerve tissue. It's estimated that 80% of the population carry this virus, but the virus is inactive in most people. Still, some 60 million people have outbreaks once or more a year. Cold sores can be triggered by sunlight, fever, illness, stress, arginine-rich foods such as chocolate. It can be triggered by food allergies or hormonal changes. And cold sores can easily last, as I mentioned, 2 weeks if they go untreated. Now, don't confuse a cold sore with a canker sore. Cold sores usually appear around the mouth, while canker sores are usually on the inside of the mouth. Cold sores are caused by a virus, while canker sores are caused by bacteria. And if a cold sore is inside the mouth, it's usually on the roof of the mouth. So what happens the first time you get a cold sore? Well, generally, people first get it when they are infants or children. Interestingly enough, only about 20% of those carrying the virus will ever get the symptoms, that is, break out in an actual cold sore. The sores can appear within days or weeks of, or even years following that first exposure to the virus. The first time that symptoms appear, they're usually more intense than the subsequent outbreaks. For example, some people experience more pain at the blister site or even flu-like symptoms including swollen glands, fever, or even sore throat. Cold sores left untreated can last up to 14 days. However, if you're beginning treatment at the first sign of the tingling, you can reduce the time to as little as 2 to 4 days. So beginning the treatment after the blister appears can also significantly reduce the time and degree of the pain that you're going to experience. So let's talk about the first day of a cold sore would be the prodrome stage. That's the tingling stage. That's before the blister appears. And one usually feels a tingling, itching, or a burning sensation beneath the skin, usually around the base of the mouth or around in the area of the nose. This is the best time to start treatment. Days 2 to 3, the blisters may start to appear. On day 4, we're going to have the ulcer or the weeping stage. This is when the blister opens up, revealing a reddish area. This stage, you're the most contagious during that stage, so generally you're also in the most pain. During days 5 to 8, you're now into the crusting stage, where the blisters dry up and a crust forms, which is yellow or brown in color. Don't pick at the crust during this stage. Let's move on to days 9 to 14. That's the healing stage. A series of scabs will form over the sore, each probably smaller than the previous one, unless you're picking at it. Don't pick at it, like I said, until finally the cold sore is completely healed. Now, in a Southern California University study, 40% of those using Quantum's product, Lip Clear Lysine Plus, avoided an outbreak. In addition, most participants skipped the blister and ulcer and crusting stages. So how do you treat cold sores? Unfortunately, there is no surefire way to prevent cold sores altogether, but there are definitely things you can do, and these methods work for a lot of folks. So I would recommend protecting your lips from the ultraviolet rays. You can use a sunblock lip balm like Lip Clear Cold Stick, which has an SPF factor of 21. Also, try to eat the right foods. Best are to eat foods that are high in lysine. Fruits and veggies are good. Beets, milk, eggs, avocados, fish, chicken, lamb, even beef, tomatoes, and more. But don't eat foods that are high in arginine, like nuts and gelatin and chocolate and coconuts, seeds, lentils, peanut butter. Watch out for those things. Also, I'm going to recommend avoiding stress. Keep your immune system strong because a cold or flu could even trigger a cold sore outbreak. You can also find ways to relax and meditate. Daily use of lysine tablets will provide a powerful immune support. So these are some of the things that you can do. I hope you found this information useful. And if you have any questions about cold sores, canker sores, dry mouth, or any issue concerning your oral health, like proper tooth care or gum problems, cavities, even cosmetic dentistry, anything related to your dental or oral health, go to my Facebook page and look for the Ask Dr. Kammer tab at the top of the page, and I'll respond. The Facebook address is www.facebook.com/healthymouth. Go there and look for my tab. Now take care and keep smiling.